Hello, I'm Dr. Raynard Washington. I have the pleasure of serving as the Public Health Director in Mecklenburg County, North Carolina. That is home to the city of Charlotte, which is the largest city in the state of North Carolina. I also am very fortunate to be serving as the chair of the Big Cities Health Coalition, which is a coalition of the 35 largest health departments in the U.S. that represent about 20% of the U.S. population. Mecklenburg County Public Health is an organization that's responsible for protecting and serving the health of our 1.2 million residents. One of the most important things that we do in terms of protecting the health of our community is outbreak response. There are so many outbreaks happening on a regular basis. Of course, everybody knows about COVID and Mpox and all of the ones that end up on the news. But every day, our dedicated team members, our nurses, our epidemiologists work to respond to all types of infections that are happening in various settings, whether it be schools or hospitals or nursing homes or other types of community locations. One of the things that was really important to us coming out of the COVID-19 pandemic emergency response was really looking at what went well and what could go better. One of the things that we did was an after-action review. And one of the things that we really struggled with during that review was trying to actually quantify what went well. We had lots of qualitative data about what was successful in the pandemic and what we needed to do better in our response, but actually having metrics, like actual quantifiable metrics that not just represented the impact of the condition or the pandemic, but also represented how well we responded. Shortly after our after-action review, we were approached by Resolve to Save Lives to consider learning more about 717. 717 allowed us to take a retrospective look at a few of our outbreaks and actually quantify how well we met a standard, which we really don't have in public health here locally. And so as a result of that, we've been able to take an assessment of multiple outbreaks, look for gaps in our response, look for roadblocks and barriers in our response, and then work very closely to be able to, with our partners and our systems, to see how can we close some of those bottlenecks that exist in the work that we do every day. One of the responses that we looked at as a part of our 717 retrospective review was a CRS case that occurred in our community last year. Our assessment showed that we didn't hit the target. We actually, in that particular response, mostly because of bottlenecks that were actually out of the control of the local health department. We didn't get notification of the suspected case. And then as a result of the delays on notification, when we went back to the healthcare facility, the hospital, to be able to do our contact tracing, it was a challenge because it had now been almost 2 weeks since the individual was in the hospital. We had to trace who was there on the day that they were there, who they potentially had contact with. And of course, anybody who's ever been into an emergency room, you know it's really, really busy and really hectic. But what this helped us do as a health department and as a community was to actually take a look, assess what went well, what did not go well, look for some of those bottlenecks, and really allow us to then work with our healthcare partners, as well as some of our laboratory partners and our internal teams in the health department to be able to identify some very key opportunities for improvement that right now we're working to try to implement. So for us, we want to now scale. We only were able to do in this first pilot just a few assessments of outbreak responses. Of course, we do hundreds of responses on an annual basis. And so now we want to take an opportunity to scale larger. We want to do more assessments. We want to be able to quantify not just a few incidental outbreaks, but also over the course of a year, how well did we do? You know, what proportion of our outbreaks have hit the target? And those are the next steps for us as a local health department. I'm excited though, because I think there's an opportunity for not just us in Mecklenburg, but for our colleagues across the country to be able to do the same thing. I think there's a great opportunity for us to continue to improve how well we're able to respond, to assess. And for us, we also think it's going to be a great opportunity to not just inform or prove how we respond, but also improve how our healthcare systems and our laboratories and our state partners are able to respond, because we'll have data to show them and share across them. So I encourage you, local health departments, leaders in states and across the country, to really consider how 717 and a quantifiable metric of outbreak response can help you in the work that you do every day. And if you have questions, feel free to come to Mecklenburg County and we'll show you how it's done.